Hello, and welcome to another school year. Regardless of if you're an upperclassman or incoming freshman, this video is new to you as we now have an athletic trainer at Brady M. Tripp High School. In this brief video, I will be sharing with you what you as an athlete need to know about concussions and how to keep yourself and others safe. Some facts about concussion. 3.8 million sports-related concussions occur annually. 20% of high school athletes who play a contact sport will suffer concussion this year. The majority of concussions occur in football, girls soccer, and girls basketball. And more than 50% of concussions go unreported. Because your school has never had an athletic trainer before, you may not know what we do. An athletic trainer is a healthcare professional who helps prevent, diagnose, perform emergency care, manage, treat, and rehabilitate acute and chronic athletic injuries. For the purpose of this video, it is helpful to know that your athletic trainer will help you through even an injury such as a concussion. Having an athletic trainer present will help you return to sport as soon as safely possible. There's been a lot of talk about concussion this far, but do you even know what a concussion is? A concussion is a form of traumatic brain injury. It is the result of a violent shaking of the brain that causes an alteration in mental status that may or may not include a loss of consciousness. Many hits or falls that occur in contact sports result in concussion, and that is why it pertains to you as athletes. Also, to reiterate, a concussion is a form of traumatic brain injury. You may not see physical injuries such as with a sprained ankle or broken nose, but deep within the brain on a cellular level, there is indeed damage. How do you know if you may have sustained a concussion? There are many signs or things that others or you can notice, or symptoms, things that you feel, that may occur immediately after or within a small window of time after the initial shaking of your brain. Signs of concussion can include loss of consciousness, confusion, incoherent speech, such as saying things others cannot understand, things that don't make sense, or just not acting like yourself, memory loss, disorientation, and dazed or vacant stares. Symptoms of concussion can include ringing in ears, difficulty concentrating, sensitivity to light, headaches or dizziness, nausea or vomiting, and fatigue. Having an AT at your school now means that you have a healthcare professional available to perform an initial evaluation and someone to communicate with each day about any lingering symptoms. In order to treat a concussion, your AT will take you through a variety of tests to determine if you are back to your baseline or normal. There will be a gradual return to play process. We need to make sure it is safe for you to return to your sport. If you return too soon, you are at risk for suffering from second impact syndrome. This will lead to massive swelling in your brain and may cause coma and/or death. Your role as an athlete is to protect yourself by reporting any symptoms of a concussion to your athletic trainer or coach. You also need to protect your teammates by reporting any signs you notice or if they are acting funny or different after taking a hit to the head. Even if they get upset with you because you are possibly taking them out of play, it is a better outcome than your teammate suffering from second impact syndrome. You must communicate with your team physician and athletic trainer if you have a history of concussion. Be honest about any symptoms. If you sustain a blow to the head that rattles you, it is a safe bet to get checked out on the sideline prior to returning to play. The faster you report, the faster you will be back on the field. If you understand all of this information, fantastic. If you want to participate in practice, you'll need to sign the concussion information for athletes form. If this form is not returned by your first practice, your coach will not allow you to participate and you can have fun watching from the sidelines. If you have any questions, the contact information for your athletic trainer, Kennedy Pipers, and team physician, Dr. Ali Folkert, are on the information sheet. Thank you for watching.